Okay, hello everyone. This is Dr. Hans, and we're going to be looking at an MRI of my lumbar spine. I've been having some issues with a lot of pain and dysfunction and numbness into my lateral left foot. And it's secondary to a disc problem that I want to show you on this MRI. If you look at the top of the screen here, see this little orientation thing that's shaded? See how it's it's a sagittal slice through a head there? That gives you a sense of the slices we're going to be looking at. If you look over the bottom left-hand corner, you see it says images 1 of 14, and then it says left going to right. So as we progress through these images, we're going to start at the left side of my spine, and we're going to go through to the right. Okay, here we go. So here we can see, a little hip joint, some muscle, but we're not really seeing the spine yet. Then the next slice, we're getting a little bit more. Now we start to see a little more. Here's the spine starting to take shape. And then one more, we're going to get a pretty good slice of the spine. So if you look at the cursor here, this is the 5th lumbar vertebrae. This is the 4th, 3rd, 2nd, and 1st. This space in between these lighter bone areas are the discs. Okay. This area down in here is 1st sacral vertebrae, 2nd, 3rd, like that. Now these are fused on some people and not on others. You'll see on mine there's pretty good discs in there. Alright, one more click in, and here, this white area here, and you can see some dark stripes in there. Those dark stripy things are the lumbar spinal nerves. The spinal cord terminates up, it's really outside of the picture here. And then the nerves come down in the neural canal. And this white stuff in here is actually cerebral spinal fluid. Now you can see, if you look at the discs, they really shouldn't extend that much from the bone. Okay, so here we have bone, here's the disc in between, it doesn't poke out. Here you got a little dark area there, that's probably just an artifact of our slice here. A little bit of bulging here. And then when you look at this disc between the L5 vertebrae and the S1 vertebrae, you can see this, what to me is a very large bulge, or actually I would characterize this as a herniation. And so that's pressing on these nerves in that area, and that's what's causing my problem. Now, remember, we're still kind of more towards the left side of the vertebrae. As we slice in towards the right, that actually goes away. You can see this is sort of a clearer picture of how it will indent that nerve sac there. And then as we go further and further right, it gets to be less and less of a bulge. And then here we come out the right side again. Okay, so here we're back to the left as we go through. And you can see here all these discs aren't really herniated. And then here this one at L5S1, a nice big bulge or herniation there that's pressing on the nerves. Okay, you can click on the link below this video to go to my website if you didn't come from there, and we'll talk to you soon.